Emergence. How pathogens cross the threshold. 1. Zoonotic spillover. The jump from animals to humans. The majority of emerging infectious diseases, EIDs, are zoonotic, originating in animals before making the leap to humans. This process often occurs when humans disrupt ecosystems, bringing wildlife and livestock into closer contact with human populations. The mechanism. Examples: HIV, AIDS emerged when a simian virus from non-human primates adapted to human hosts. COVID-19 is believed to have originated in bats, potentially jumping to humans through an intermediate species at wildlife markets. The perfect storm. High-risk activities such as deforestation, wildlife trade, and factory farming create the conditions for zoonotic spillovers. These activities increase the interface between humans and animals while fostering environments where pathogens can mutate and adapt to human hosts. 2. Novelty and lack of immunity. Pathogens that spark pandemics are often novel, meaning the human population has no pre-existing immunity. Without prior exposure, vaccines, or treatments, the disease spreads rapidly and can overwhelm health systems. Why it matters. Examples: the 1918 Spanish flu, SARS, and the 2009 hydrogen nitride pandemic all involved novel strains of influenza or coronavirus. Mutation and evolution. Viruses like influenza and coronaviruses evolve through genetic drift, gradual mutation, or genetic shift, reassortment of genetic material, allowing them to bypass existing immunity. 3. Environmental disruption and climate change. Climate change and habitat destruction force wildlife into closer proximity with humans, increasing the chances of pathogen transmission. Rising temperatures also expand the range of vector-borne diseases, such as malaria and dengue, as mosquitoes inhabit regions that were previously too cold. Driving the spillover. Examples: the spread of Zika and West Nile virus has been linked to changing climatic patterns. Amplification, the human factor. 1. Urbanization and population density. Urbanization concentrates large populations in small areas, providing a fertile environment for pathogens to spread rapidly. Poor sanitation, inadequate healthcare access, and crowded living conditions exacerbate transmission. Crowded cities as disease incubators. Examples: the 14th century Black Death thrived in overcrowded medieval cities with poor hygiene. Similarly, modern slums in megacities are at heightened risk for outbreaks of diseases like cholera and tuberculosis. 2. Globalization and mobility. Modern transportation systems allow pathogens to move faster than ever before. An infected individual can board a flight in one hemisphere and spread the disease to another within hours. A connected world. Examples: COVID-19 spread globally within weeks, facilitated by international air travel. The 2009 hydrogen nitride pandemic followed similar patterns, moving quickly through global networks. The ripple effect. The same networks that enable trade and tourism also create pathways for disease, turning local outbreaks into global crises. 3. Asymptomatic and pre-symptomatic transmission. Many pathogens spread before symptoms appear, making containment especially challenging. Asymptomatic carriers continue their daily activities, unaware they are contributing to transmission. The hidden carriers. Examples: COVID-19 and influenza are notable for their ability to spread during pre-symptomatic phases, complicating efforts to isolate cases early. 4. Human behavior and social structures. Social behaviors, such as mass gatherings, communal eating, and certain burial practices, can accelerate the spread of disease. Cultural resistance to public health measures like quarantines and vaccinations can further exacerbate outbreaks. Cultural and economic practices. Examples: funeral practices involving direct contact with bodies contributed to the spread of Ebola in West Africa. Vaccine hesitancy has fueled the resurgence of diseases like measles. The rapid spread of misinformation, especially via social media, can undermine public health efforts, as seen during the COVID-19 infodemic spread from local outbreak to global crisis. 1. Initial containment failures. Outbreaks often begin in isolated regions but spread due to delays in detection and response. Early containment efforts may falter due to lack of resources, inadequate infrastructure, or political hesitancy. Missed opportunities. Examples: delays in reporting and containment contributed to the global spread of SARS in 2003 and COVID-19 in 2020. 2. Super spreader events. Large gatherings, such as religious ceremonies, concerts, or sporting events, can serve as super spreader events, amplifying transmission. Multipliers of transmission. Examples: a religious gathering in South Korea was linked to a significant portion of the country's early COVID-19 cases. The Hajj pilgrimage has historically posed challenges for infectious disease control. 3. Healthcare system strain. As cases multiply, healthcare systems can quickly become overwhelmed, reducing their ability to provide effective care and containment. Shortages of personnel, equipment, and hospital beds amplify the crisis. Overwhelmed infrastructure. Examples: during COVID-19, hospitals in Italy and New York City were stretched to their limits, with catastrophic consequences. 4. Global inequities in health resources. While wealthy nations may have robust healthcare systems and access to vaccines, low and middle-income countries often face resource constraints, leaving them disproportionately vulnerable. Uneven vulnerabilities. Examples: HIV/AIDS devastated sub-Saharan Africa due to delayed access to antiretroviral treatments, while wealthier nations contained the crisis more effectively.